On the day of the operation, just before we start, I'll make sure that I come out to see you before we get going. Make sure you're comfortable, and if you've got any last minute questions, it's probably a good time to ask me. Because you'll be asleep, I'll introduce you to my team. On the left hand side we have Tia. She's handing the instruments across to Michelle there, who has her back to her and is wearing the coloured cap. And in the foreground is my assistant Kathy. And the four of us have been doing this together from the start here in Toowoomba, so it's very reassuring to have the same team. But before we do anything, we have to make sure our hands are scrubbed nice and clean. All three of us do this, and we probably do it maybe a dozen times a day, so it does become second nature. But it is very important. And I suppose we have developed our own way of washing our hands. We have to make sure while we are doing it that we don't touch the splashback or nudge the taps, because then we have to start right from the beginning again. If you want some more soap, we have to use our elbows, and we do this at least 3 times before we go in to start the operation. I don't know how the girls manage, as they clean their hands as much as I do, and they must go through bucket loads of moisturiser. Kathy here has her own style of washing, certainly different from mine. She's got a very delicate touch. Not only does she do a great job of assisting me during the operation, but also she takes great care of dressing your wounds afterwards. And then we gown and glove. In my case, I wear a 7.5 size glove. We have to be very careful to make sure we don't rip them while putting them on, as it is easy to do because they're latex. And of course we do have a non-latex variety in case you are allergic to it. And while we're getting ourselves ready, the anaesthetist is putting you off to sleep and keeping you warm. And here we can see Dr. Kraft in the background. And then we start to get our own instruments ready. And while Tia and Michelle get all of those instruments out, Kathy and I will give your belly a last scrub with preparation solution. We still have a little work to do before we start. We have to put the equipment together, and we can only do that after we have you asleep on the operating table and in the correct position for the operation. We use some pretty cool equipment, as well as you can see here. Well, it's time to look away if you're squeamish now, because it's right here on your stomach area that I'm going to be doing the operation. You can see here's your liver at the top of the screen, and your stomach is the pink thing just below it, and it's being held out of the way with a retractor. It's right here at the top where we will place your gastric band, and in the case of a sleeve gastrectomy we'll remove the outer 2/3 of your stomach. From here it'll probably take me another 15 or 20 minutes to finish the gastric band operation, and after that the same anaesthetist that puts you into that deep sleep will rouse you from it again, and they'll take you back to recovery and back to your ward for some rest.